Welcome to The Explainer. Today, we're diving deep into one of the most painful and frankly baffling conditions known to medicine, complex regional pain syndrome, or CRPS. And to even begin to understand it, we have to hear from the people who live with it. To really get what CRPS is all about, you have to start with the words of those who experience it every single day. This quote from a patient named Sharon, it just cuts right to the heart of it. This isn't just a little discomfort. It's a catastrophe happening inside your own body. So, what exactly is this condition that can cause such unimaginable pain? How does something as common as a sprained ankle, something we've all had, suddenly spiral into a daily, relentless war?
Okay, so here's the official medical definition. But what that really means is CRPS is defined by one completely bewildering feature. The pain just doesn't make sense. After an injury, sure, you expect pain. But with CRPS, the body's alarm system doesn't just go off, it breaks, and it's left blaring at full volume long after any real danger has passed.
And this really lays it all out, right? With a normal injury, pain is a useful signal. It tells you something's wrong, and then as you heal, it fades away. It's predictable. But with CRPS, the nervous system gets trapped in this vicious feedback loop, amplifying pain signals into a constant, agonizing roar. It's a fundamental miscalculation by your body's own wiring.
But look, that initial pain? That's just the tip of the iceberg. To really understand CRPS, we have to look at the true physical, emotional, and social toll. We have to understand the lived experience of having a body that is, quite literally, at war with itself.
So, the pain, it is the central, dominating feature of this condition. Patients describe it as this constant, severe burning, or a deep throbbing, or like a live wire of electricity. As Morgan's quote shows, during a flare-up, the pain isn't just a sensation, it is a force so overwhelming it can shut down everything else. And again, the pain is just the beginning. From there, you get this cascade of other, just bizarre symptoms. There's something called allodynia, where a stimulus that shouldn't be painful at all, like a light breeze or the touch of a bedsheet, feels like a blowtorch. The affected limb can change color and temperature dramatically, and over time this can lead to muscle wasting and permanent changes. It's a multi-system breakdown, all focused on one part of the body.
This is where it gets incredibly heavy. There's a reason CRPS has been nicknamed the suicide disease. And that's not for shock value. It's a reflection of a grim reality. When pain is that severe, that constant, and that misunderstood, it can completely shatter a person's will to live.
And as if the physical and psychological agony weren't enough, there's the social burden. Because CRPS is often invisible from the outside, patients are constantly disbelieved by friends, by family, sometimes even by doctors. Hearing someone say, "You don't look sick," when your limb feels like it's on fire, well, that creates these deep emotional wounds of isolation and invalidation.
So you hear about all these severe, life-altering symptoms, and you think, okay, getting a diagnosis must be pretty straightforward, right? But for most patients, it's a long, frustrating, and often demoralizing journey just to get a name for their suffering. And here's the heart of that challenge. There is no single test for CRPS. There's no blood test, no x-ray, no scan that just lights up and says, yep, that's it. It's a clinical puzzle, which makes it incredibly difficult to identify, especially for doctors who aren't familiar with it.
This timeline shows what so many patients call the diagnostic odyssey. It's this agonizing period of confusion and self-doubt. You're going to doctors, they're running tests, and they keep telling you everything is normal, that there's nothing wrong, all while your pain is just getting worse and worse. For some, this can drag on for years.
So how do doctors figure it out? Well, it's basically clinical detective work. They rely on a tool called the Budapest criteria, which is essentially a checklist of signs and symptoms. They have to carefully listen to the patient's story, observe the physical changes for themselves, and then meticulously rule out everything else that it could possibly be. But here's the thing. Getting that diagnosis, it isn't the end of the road. In fact, for so many people, it's the beginning. It's the starting line for the fight back, It's the moment they can finally start forging a path forward, armed with treatment and an incredible amount of resilience.
And this is why getting that diagnosis quickly is so critical. There is a window of opportunity. The research is becoming clearer. If you can get early, aggressive, and comprehensive treatment, usually within the first year, up to 80% of patients can see a significant recovery. This totally challenges the old bleak belief that CRPS was just a life sentence of pain.
Now, there is no magic bullet here. The treatment is a multi-pronged attack. The absolute cornerstone is physical and occupational therapy. You have to keep the limb moving and retrain the brain. Then, that's combined with a whole cocktail of medications, advanced procedures like nerve blocks, or even spinal cord stimulators, and absolutely crucial psychological support to handle the mental and emotional toll.
And beyond the clinic, this is where you see some truly incredible stuff. Patients develop their own personal arsenal of resilience. They find purpose in creative outlets, they use humor to cope with impossible situations, and many transform their own pain into a mission to advocate for others. They don't just survive, they adapt, and they find new ways to live a full and meaningful life.
This powerful perspective from Jaden, it just says it all, doesn't it? It shows how, for some, the immense struggle of CRPS can actually forge a profound new sense of self and strength. It's a real testament to the incredible resilience of the human spirit. Okay, so this individual resilience is amazing, but it often doesn't stop there. It builds into something bigger, a powerful collective movement. So how does one person's story join with others to become a collective roar for change?
This single shocking number right here, it explains the entire motivation for the CRPS advocacy movement. Less than 1% of all healthcare research funding goes to studying pain. For a rare condition like CRPS, that sliver gets even smaller. It essentially leaves patients and their doctors fighting in the dark.
And that shows you why awareness isn't just some feel-good slogan. It is the essential catalyst for real, systemic change. Awareness is what drives funding for research. It's what educates doctors to shorten that terrible diagnostic odyssey. It's what fights the stigma and social isolation we talked about. And it builds a community so that no one has to face this battle alone. And this is where so many patients find their power again. For advocates like Tiffany, sharing their story becomes a way to reclaim agency. They take their own suffering and they turn it into a tool to help others, to make sure the next person doesn't have to face the same pain and isolation. Ultimately, the story of CRPS is a complex one. It's about biology, psychology, and community. It's a story of a body's malfunction, a person's fight to be believed, and a community's struggle for recognition. And it leaves us with a final thought-provoking question. In a world full of misunderstood illnesses, how do we learn to truly listen to pain and to the people who are experiencing it? Thanks for watching.